Year 12, this is another flipped learning activity, and we're going to be today looking at Unit 4 in the core health priorities in Australia, and the critical question is what actions are needed to address Australia's health priorities. Now, we're going to, later on in this unit of work, we're going to look at or revisit the Ottawa Charter, because we did cover it last year in Year 11. And there are 5 action areas of the Ottawa Charter. This is the main basis of this unit of work. We have to apply the Ottawa Charter to health promotion initiatives. So, looking at the syllabus, we can see that you need to, the dot point is health promotion based on the 5 action areas of the Ottawa Charter. And you need to have an understanding of what the levels of responsibility are for health promotion and what the benefits are of the partnerships that develop within health promotion. So these partnerships exist between governments, non-governments, and the local community. Now you have to be able to argue the benefits of health promotion based on those groups working together, and you have to know about the 5 action areas of the Ottawa Charter. So just quickly, just to make sure we know exactly what health promotion is, we did this definition last year. Health promotion is the process of enabling people to increase control over and improve their health. So it doesn't just focus on their behaviours, it also focuses on a wide range of other interventions. So just looking at who's responsible for health promotion, we can see that there are a number of groups. Now, don't get confused between levels of responsibility of healthcare and health promotion. We covered that earlier in the Unit 3. So this is looking at the same groups, but we're looking at health promotion rather than healthcare, the healthcare system. So there are a number of levels. There's individuals, there are groups in the community, all levels of government and NGOs all have a role to play in promoting health, and if they all work together, it can be a very successful process in promoting the health of people. So looking just quickly at the federal government, their role is in developing public policy, in planning and monitoring and researching, and providing support for health initiatives in states. As far as the state government, they identify public health issues through epidemiology, and they also develop and monitor preventative and early detection programs such as cancer screening, and bowel cancer is one of the examples of that. The local government, on the other hand, they maintain our roads and local infrastructure. They also have an important role to play in developing recreational facilities, things like cycleways and parks and walkways, all help people to maintain a healthy lifestyle, and they also have a role to play in food safety and immunisation. The non-government organisations, organisations like the Cancer Council and the Heart Foundation, they have an important role to play in lobbying the government for change. The Cancer Council were very instrumental in getting a lot of the changes to legislation in regards to smoking. So that's their main role. They also provide a lot of educational resources for different groups, particularly schools. Right, now, looking at the benefits of partnerships, I want you to be comfortable with using these 2 words. It's intersectoral collaboration. Now, what that means is that there are different sectors, as we've just seen, different sectors, individuals, schools, communities, and all the levels of government and non-government organisations. They all need to be working together, and if they do that, it's referred to as intersectoral collaboration. So collaboration is everyone being involved in something and playing a role. So if that happens, there's a greater likelihood of of health promotion initiatives succeeding. Okay, so some other benefits of, let's go back. Other benefits of an intersectoral approach is we can share resources and knowledge and expertise. It can be addressed in a more comprehensive way. It's much more cost effective if different groups are working together and there's less duplication of effort. We know that many health issues are very complex and they're affected by a number of determinants, environmental, social, cultural determinants. So if you address it from a number of angles, the likelihood of success is much greater. And involvement of communities and NGOs in lobbying for policy change means that policies will be reflective of the needs of the population. Now, just quickly look at one example of the value of working together in health promotion and having this intersectoral collaboration is in tobacco control. Now, we'll look at it a little bit more depth and we'll actually apply the Ottawa Charter to what's called the National Tobacco Strategy. But just quickly, this illustrates how if groups work together, we can actually have very successful health promotion initiatives. So firstly, we have the government working, they've actually raised taxation and regulated tobacco sales. There's been a lot of money put into research into lung cancer. Schools run programs to educate kids about smoking. There are warning labels on cigarette packets. There have been changes to legislation brought about by, as I said, the lobbying of Cancer Council and the government making those law changes to make it now basically very difficult for people to smoke indoors. And there's been a lot of mass media campaigns on TV, internet, radio about the dangers of smoking. Also, there are a number of community-based initiatives based around providing quick programs for people. So all these things working together has actually decreased the number of people, or the smoking rates of people over the last 30 years. It's been very, very successful. Okay, that ends this lesson. There'll be a number of activities you need to do in regards to a test and also some working class